Hello everyone, my name is Dimitrios Pantazis and I'm a principal research scientist at the McGovern Institute for Brain Research at MIT. I'm also a principal investigator at the J Clinic for Machine Learning in Health. Our research project, conducted with the support of J Clinic, is the development of a deep learning system to identify biomarkers for early detection and monitoring of Alzheimer's disease. Alzheimer's disease, or AD, is the most common cause of dementia with debilitating symptoms, including memory loss, cognitive dysfunction, anxiety, and aggression. The significance of Alzheimer's disease cannot be overstated. More than 47 million people worldwide are estimated to have AD and related dementias. This number is expected to reach 152 million by 2050. 1 in 6 women and 1 in 10 men who live past the age of 55 will develop dementia. And the healthcare cost in the US is projected to increase from 175 billion in 2019 to more than 1.1 trillion in 2050. Given the devastating nature of Alzheimer's disease, global forums such as the Alzheimer's Association International Conference recognize our first priorities, the development of in vivo AD biomarkers of neurodegeneration, so we can track key stages in the AD pathology. This would facilitate drug development and lead to better patient management and behavioral interventions. The key idea behind our project is that Alzheimer's disease is a brain network disease, also called connectopathy. It is believed that Alzheimer's disease is based on the buildup of two proteins in the brain, amyloid beta and tau, even 20 years before clinical symptoms. These proteins are not distributed randomly, but rather accumulate in characteristic spatial patterns. Eventually, they cause specific connectivity alterations in large-scale brain systems. Unfortunately, amyloid beta and tau are unsuitable for general population screening. This is because amyloid beta and tau accumulation maps are only possible with positron emission tomography scans, which are expensive and involve exposure to radioactivity. Therefore, to enable general population screening, in this project we focused on capturing functional connectivity alterations. Specifically, we developed an inexpensive biomarker of AD using magnetoencephalography functional connectivity networks. Magnetoencephalography, or MEG, is a non-invasive brain imaging method that uses magnetic sensors surrounding the head to measure the extraordinarily weak magnetic fields emitted from the human brain. It provides a direct index of neural activity, enabling us to detect even tiny brain connectivity alterations. To design an early biomarker of AD, we used a dataset comprising of 76 mild cognitive impairment patients and 53 age-matched clinically normal controls. We collected 5 minutes of eyes-closed resting state MEG data while the patients were seated in a 306-channel MEG system housed in a magnetically shielded room. The MCI patients were followed up for approximately 3 years after their MEG recording session, and were further divided into 2 groups according to their clinical outcome. The stable MCI group comprised the 48 patients that still fulfilled the diagnosis criteria of MCI at the end of the follow-up. The progressive MCI group comprised those 28 patients that met the criteria of probable AD. Using the MEG data, we constructed functional brain networks. The goal was then to identify which features of these networks are important for the prediction of AD. For this, we resorted to deep learning methods. The model we developed is called Multiple Graph Gouss. It is optimized to analyze non-Euclidean structured data in the form of graphs, such as the brain networks in this project. Specifically, our model receives as input the high-dimensional MEG network data and uses a 3D encoder to embed the data to a simpler low-dimensional space. In this low-dimensional space, the data are represented as multivariate Gaussian distributions. These representations explicitly encode uncertainty and are much easier for machine learning algorithms to analyze. Using the output of our multiple graph to Gauss model with traditional machine learning classifiers, we were able to distinguish normal controls, stable MCI patients, and progressive MCI patients. Of the algorithms tested, random forests achieved the highest performance. For example, in the 3-class classification, it achieved 81% accuracy. We also identified the brain regions with significant MEG network alterations due to AD progression. These regions largely include areas in the temporal and frontal cortex, which is consistent with findings from previous studies using different imaging data. This includes, for example, the parahippocampal cortex and other areas which have been associated with profound memory deficits in AD. Taken together, we developed a novel deep learning system called Multiple Graph Gouss to analyze MEG brain networks in Alzheimer's disease. We successfully discriminated normal controls, stable MCI patients, and progressive MCI patients with up to 81% accuracy. We also identified brain regions that are susceptible to functional alterations early in the AD pathological cascade. Finally, with our ongoing work, we're committed to developing even more powerful biomarkers based on multimodal data. These biomarkers will use data from multiple sources, including the MEG data presented here, but also positron emission tomography brain networks of amyloid beta and tau proteins. These data will be integrated with deep learning models to yield even more robust biomarkers of Alzheimer's disease. They will also reveal the underlying pathological mechanisms of AD, namely how amyloid beta and tau protein deposits relate to each other at the large-scale network level, and how they compromise synaptic activity.